Why are there concerns about high insertion torque when some studies don't really show a problem? And of course, this is for a few reasons. We know that if we put an implant in with a very high torque and a lot of pressure, sometimes I've seen some of our residents really torque in those implants and have very high insertion torque. And this, as we know, can lead to bone loss and pressure necrosis. And so certainly, do we need a high insertion torque? What is ideal, and are there other measures that we can utilize? And then, of course, we have the resonance frequency analysis, and this is really a lateral bending test similar to a tuning fork. And this looks at the stiffness of the bone to implant interface and really getting a sense of that connection between the bone and the implant. This is a non-invasive measurement, just like insertion torque and just like the perio test, but certainly not like removing the implant and looking at that bone to implant contact histologically. The transducer is attached to the implant, and the frequency waves are sent to that transducer, and the vibration is transmitted and when it's measuring the RFA at the bone to implant interface. And so this has been used for several decades already, and there's a lot of literature and a lot of data out there about the RFA. And then the RFA measurement gives you ISQ values from 1 to 100. Hopefully none of us are getting 1s when we're putting our implants in, both at the primary and at the secondary stability phase. And this represents resonance frequencies anywhere from 3.5 to 8.5 kilohertz. And so these are going to be the correlations. But obviously we're getting this numerical value that is valuable in terms of the number itself, and also to compare over time with the patient as the implant is healing in the site.